Today we have Portia. She's 36? 35, sorry. So she's attractive. She wants to be more attractive, more beautiful. So we plan first to erase her nasolabial fold, to do a little bit of her lips. But what's going to bother her more is the jawline. So we're going to make this jawline more straight and the angle more visible. And then we discussed that could be a good idea to project a little bit the lateral side of her mid-face, the middle area. And why not injecting the nose, which is a little bit dropping and convex. So we're going to start, finally, we're going to start with the jawline and then the nose, nasolabial and lips, and we will end up with the mid-face. Okay? Okay, so we use this antiseptic gauze because we don't want to touch the skin with the cannula. The entry point of my needle and cannula would be at the edge of the gonion. So I put a finger on the vertical branch of the mandible, another finger on the horizontal branch. So you see it's very oblique. It's not that sharp and horizontal. So we have to create all that volume, all that space. So from the gonion, right there, we're going to create a new angle right here with a needle. Sorry. Okay, this is a 23 gauge needle. And this is provided in the box with the cannula of 25 gauge. So from this entry point, I'm going to end up at the pre-jaw sulcus, which is enough. I don't need to go further. Oops. Right. So she has a good skin. We see the elasticity. So when you have this resistance, you pinch the skin like this, and you drill a little bit, and now we are under the skin. What is important is to inject lower than her mandible and subcutaneously. Otherwise you're too deep and you need more product, and especially, and also it's a bit dangerous. So subcutaneously, zero risk. Voila, so I create that new shape from the gonion down there. You see why I'm using the antiseptic gauze, because I don't want to touch her skin and hair. Otherwise I have to change the cannula. And now I'm doing anterograde and retrograde injection. Ça va?
Oui,
okay.
Ça va, merci.
Ah. So you speak a bit of French, c'est bien. Ah, c'est bien. Yeah, Vivacy is a French company with a French style, but it's international now, with trained doctors around the world, a good reputation around the world. Voila. So this double XL is a strong and very cohesive gel. It's the more viscous and cohesive gel in the range, the Vivacy stylage range. Voilà. Mandible. Maybe I can use a bit of this gel to go a little bit vertical branch of the mandible right here, using the same entry point. Here we are. So we do the vertical branch of the mandible. Okay. So this is with 1 ml. So we lower the mandible angle. And if we look at the other side, we have more projection. So this is with just 1 ml with a cannula. I suggest we do half side of this, and then we go to the other side. Okay. Alors, we go for the other side of the jawline. Use that gauze to protect the skin and the ears. Voilà. I'm going to stick that gauze on the skin. And remember, we put one finger on the jawline horizontal branch, one finger on the vertical branch, and this is where is the gonion. So what I want is to lower that mandible, so I'm not inject here, I will inject a little bit lower here. And you have to be tangential to the skin, not perpendicular, otherwise you are going on trouble deep here, because they have some branches of the facial nerves, you have the really deep the external carotid and internal carotid. However, if you stay subcutaneously, it's very safe. Okay, so we're going to use double XL and all the lengths of the cannula from here to here, and lower than the mandible, creating a shape like a triangle. Okay. We're lucky this side is not bleeding, so I use the entry point, and then I go subcutaneously. You can also pinch the skin like this to know where you are and to create the tunnel. It's easier. Voila, up, and those are the retaining ligaments under the mandible. So I go up to the prejaw sulcus. Ça va, Portia? It's not painful? And now I inject retrograde and anterograde to create that shape. Okay, because if you inject on the mandible, her mandible will look still short. So that's why I start a little bit lower. And now we create this horizontal branch. Okay, a bit of the gonion here. Right, and I save 0.2 ml to go for the vertical branch like this. So you pinch the skin, and from the same entry point, voilà, you do your injection for the vertical branch. Okay. You can also stab again with the needle, but I see the gel is coming out. See how thick is the gel? See, it's a good cohesive gel. It's because I squeeze with my fingers. Voila. Okay. Alors. So this is 1 ml. We'll see if it's enough. Now we can go for the nose. And for the nose, I'm going to use Steel Edge XL. So we're going to use XL on the nasal spine to lift the tip of the nose and to project that and support that tip. And then we're going to use really minimal amount of product, because if you start from the dorsum, you drop the tip. So it's very important to start on the nasal spine. That's going to be a bit painful, Portia, sorry. Voila, okay. And lucky we are on the Steel Edge XL, we have lidocaine. So we try not to touch the nasal spine, the bone, and inject slow. So the lidocaine numb the area step by step. It's okay? Mm-hmm. Voila. And I use all the lengths of the needle, and then I already injected 0.3, 0.4, and I'm injecting retrograde here to open that angle, right? With this Steel Edge XL. We already injected 0.7. The last trick is to bend the needle on the sterile cup, because we're going to use the same entry point. It's less painful, and go into the columella in between the two alar cartilages with no risk for the vessels, because they are very lateral. Even the branches for the columella are lateral. And also I don't like to put a needle on the tip, because it's very delicate and nice. So you see we inject on the step 1 was the footage on the nasal spine, step 2 columella, and step 3 I try to lift the tip with the last 0.2 ml, and you see how we open the nasolabial angle nicely. And probably, I don't know if she needs something here, we will see at the end. Okay? Now we can go for the nasolabial folds. Nasolabial fold, I like to use the stylage M. So stylage M, and I follow the line intradermally because she has a very deep wrinkle. If you use a cannula, you will have no effects on that nasolabial fold. So I stop here, so I start a little bit before. It's an anterior grade injection, intradermally, and a bit subdermally. Voilà, and safe because the artery, facial artery, is deeper, like 1 centimeter deeper. Okay, I use all the lengths of the needle. I do a fanning, intradermal, like this. Okay. You can do a bit of crisscross injection, like this, intradermally again. And that gives a good support and a good treatment of those nasolabial folds, which is impossible to get such a good result with a cannula, because the cannula will go on the easy space and not where the skin is stick to herself. And now to finish her face, before I do the lips, I take my time for the lips because the lidocaine of the XL on the nasal spine and on the M will numb the lips, so I will do the lips at the end. Now I want to project more her mid-face. So finger here from the corner of the mouth to the angle of the eyes, a line from the tragus to the nostril. At the junction here, down to the bone, we can do the projection of the mid-face on the malar bone. Right. So I'm going to use, I plan to use half a cc, but I think she needs a little bit more than half a cc. I will use another XL. We can start with the 1 ml, but for a better projection, we need a full syringe. And I like that point. The last point here is very high, because with that point you create the illusion that you have a slanting mid-face. Voila, perfect. Open your eyes. Okay. Right. So you see have a better projection here on the mid-face. A good treatment of the nasolabial. It's a bit red because of the injection. And the tip is open now. Nasolabial angle is open and nasolabial folds. So a anterior grade injection at the junction of the red lip and the white lip to do contouring, a little bit of volume. You see I'm using an angle of 20 degrees here, and I subcutaneously, and here I'm a little bit intramuscular, but it's safe because the labial artery is at the junction of the wet lip and the white lip. Voila. So I'm doing a bit of molding, so that's going to be a bit painful portion. Voila. The cupid bow. Voila, superb. So we create that nice shape on the upper lip. That's 0.3 ml on that side. I'm going to use the same, another 0.3 ml. So contour and a bit of volume, following that margin, the lip margin, and a little bit down to the muscle. Okay, and the cupid bow. Voila. And that's 0.6, 0.3, 0.3. So I still have 0.4, and this 0.4 I'm going to use it medially to get this nice shape here. So I use an entry point here. I stop right there. I just start before to have the lidocaine in effect. And I'm using really an injection at the border to create like a balcony to avert my upper lip. And the trick is to use a Q-tip like this, so then you can really nicely invert the lip and block the skin So with a few amount of product, you have a better effect. Voila. Okay. 0.4, 0.3, 0.3 with 0.6 ml. So we'll finish this injection with a nasolabial fold again with stylage M. So it's very easy. You start from the lowest point, intradermal injection. Where you start a little bit before, right? Intradermally. Okay. And you follow this nasolabial fold. So this is the easy injection. And it's very safe if you stay superficial. It means like you follow your tangential to the skin. Open the mouth in a second. Voila, I have a nodule here, so I do a bit of massage. Voila, super. Okay. Again, we cross the injection, a little bit more superficial, and that creates a net, and the product stays longer, and we have a better definition of this area. And as we did on the other side, we can inject also the upper part of her nasolabial fold, so it's an injection deep down to the bone. So we have 0.1 ml. I want to use it on the dorsum or her nose. See, it's not that perfectly straight. So I use 0.5 here. Ça va?
Oui.
Okay.
Merci.
Really medially, so it's safe. And also I want to lift a little bit the tip here with 0.5 ml, just to create a little bit of a break here. Voila. Done. Okay, so on the front view we don't have an overcorrection. More you inject and more you lift the tip, more you have this tip who is spreading, so it's enough for one session. I always ask the patient to come back after a month for the adjustment and the touch-up, eventually a touch-up. You can open your eyes, it's done. With the injection here on the mid-face to lift this area. So the first bolus is 0.5 ml. Voilà. With this we create the shadow and the convexity here. 1 centimeter away from this entry point, a second bolus of 0.2 or 0.3, sorry. Voilà. Ça c'est bien. I think that side is enough. Let me check. Open your eyes. Ouais, ça c'est bien. I have to do a little bit more here. Voilà. C'est bien. And as I have 0.1, I will use it here. Just recreate a little bit more of jawline contouring. Voila. Perfect. So in conclusion, we use 1 ml per side of stillage M, 1 ml of stillage Lips Plus on her lips, 1 ml of double XL per side with a cannula on the gonion, plus 0.1 ml of XL here as a touch-up. And we use 1 ml of XL on the cheeks, on the mid-face, the middle area, and 0.9 on the left side because of the asymmetry. And we'll also use 1 ml of XL on her nose, plus 0.1 and 0.1 0.2 ml of M on her nose.